having young men in their early 20s leading these groups of conversation, which is so important, is great, because they're not that much older than these boys themselves. So they've been there and it's fresh in their minds, the facilitators' minds. They can relate perhaps more than what I can, being 50. That hopefully that the lessons span the generations.
Yes.
And the young men who are leading it can give their experiences and tell them how important it was. Tell them how important perhaps conviction would have been to them if it existed when they were going through school. I've learned a lot about mental health through my wife's mental health issues with postnatal depression, her mother's, and I think it's one of the biggest single issues facing young men and women, and it's about empowering them to have the courage to say, you know what, I need a hand, I need help. We help people who have cancer, we help people who have diabetes, we help someone who's got a broken leg, for goodness sake. But we seem to look down on people who say, I'm doing it tough. I think I might be depressed. There shouldn't be any stigma surrounding mental health, and these young men need to know that, because again, if they put their hand up, they are building the foundations for a healthy future. And if they take that and don't put their hand up, then who knows what their future could be.